just on the weekend, just 5 days ago, you put out a note saying schools were going to reopen. What happened? What changed so dramatically in 5 days?
We received data and advice from the Chief Medical Officer of Health yesterday with pretty shocking outcomes related to a dramatic spike of COVID cases amongst youth-aged citizens in our province over the holidays. 117% increase is alarming by any measurement. And upon receiving that information yesterday, I'm here today confirming, regrettably, knowing that we all wanted kids to get back. I am a strong advocate to getting children back for their mental health and their development. But in good conscience, getting data that suggests that there has been a spike in transmission in the community over the holidays, I'm not going to put, and the Premier has been clear, he is not going to put our kids at risk, given the sacrifice and given the good progress made in keeping schools safe and open in this province.
You've extended the online learning for 2 weeks. Do you think that that might be extended even further if the numbers don't change?
Look, we want to get kids back. And I mean, I want to be very clear to Ontario parents. I am absolutely committed, firmly, resolutely committed to getting kids back for their mental health, for their development, and obviously for their learning. The Chief Medical Officer of Health is going to give us guidance on when it is safe. But in the meantime, I'm not going to be hoping for the best. As Dr. Williams said, we're working together, the Premier, the Chief Medical Officer, as well as Minister Elliott and I, to build up a protocol that allows the kids to go back on the 25th, the dates that has been extended to. We're going to be looking at 2 priority areas of expansion. The first is in asymptomatic testing. We've done that in this province, one of the only provinces to do so in the highest risk
I might
regions
add. And you
Toronto.
only started doing asymptomatic testing just before the holidays. Why didn't you start it in September from day one so you actually could have tracked what was going on? We know a lot of kids are asymptomatic. So why didn't you want to find out where they were?
Well, to be fair, we're one of the first provinces, I believe the only province, to have unveiled an asymptomatic program.
But I'm not comparing other provinces. We're looking at Ontario. We're looking at Canada's biggest province. Yeah. And do you think you neglected to look for COVID in schools amongst asymptomatic students? Was that a failure?
We had surveillance testing in this province, the first in this country, and we unveiled it in the fall with 9,000 tests completed, of which there's a 2% positivity rate. So let me just challenge your point that there's—
No, I'm going to challenge you there too, because if you look at that positivity rate and you look at it compared to the tests that have been done in the general population, it's actually very high. It's deceiving how you're painting that picture. And we've seen the cases rise in the schools. Before Christmas, it was 20% of schools had a case. So we knew that this is a growing problem.
80% of schools in Ontario at the peak of transmission, on the day we closed schools in December, did not have a case of COVID at all.
Did not have a symptomatic case of COVID, my minister.
There were no active, sorry, I just want to finish the thought. There were no active cases of COVID in schools reported on the public database. 8 in 10 schools didn't have that. That's a matter of fact. In addition, we unveiled asymptomatic testing. In the highest risk regions of 9,000 tests, there were just over 200 cases confirmed, according to public health units, of which that represents a 2% positivity rate, below the provincial average, by the way, at that time. What it shows, not my opinion, the Chief Medical Officer of Health at the time, is that so far, that testing's demonstrated we're not seeing mass asymptomatic spreading. That's the opinion of the Chief Medical Officer of Health, respectfully, not mine. I'm just echoing it. Why we're going to be expanding it is because we appreciate that information is a strength. And obviously COVID transmission is not just an issue in the highest risk regions. So we're doing that. We've committed to doing that in December. We're ready to do it for Monday, should schools have reopened. But we'll have that plan opened, unveiled, and available for families, for teachers, and of course for the kids themselves for when they get back.
So Minister, when students do go back, what kind of asymptomatic testing will we see in schools? Will it be widespread? Will it only be in hot zones? What are you planning?
The aim is to have province-wide capacity. Tens of thousands of tests is required per day province-wide to do asymptomatic testing where it is needed. So the public health unit leaders can say, look, in this area, we see a high rate of positivity, we need to deploy asymptomatic testing. They will have the resources, the agents, the actual test kit, and the staff to get out there and do those either cohort or school-based or community-based testing. That's what we've been doing with some sense of success, and we want to expand that now province-wide. In addition, we're going to be unveiling an additional $380 million of new funds, of which the focus is going to be on air ventilation improvements. The fact that 95% of schools in this province have not just reviewed, but updated their air systems is a strength, but we think we can go further. An additional investment in air ventilation, an additional procurement of portable ventilation systems. We're going to put more money in PP and staffing and in custodians just to enhance the cleaning protocol with the rising risk. So we're working in partnership. We're not hoping for the best. We're acting decisively over the coming weeks to build out this protocol, unveil it, so that parents know that we will not rest on our laurels. We'll do whatever it takes to get these kids back. We know how important it is.
With respect, Minister, why wasn't all this done in September? Asymptomatic testing, better PPE, better ventilation. Why wasn't this all done at the start of the school year in September?
In every area, we have 3,000 more teachers that were hired over the past months from September to the present.
But you're still acknowledging more needs to be done.
I'm acknowledging that our province has had an incredible success according to medical leaders, not just at the command table, not just the chief medical officer of health, doctors in the field in pediatric institutions in this country, saying that Ontario's plan has worked and has led the nation. We got to December. I'm proud of that. Kids are better off for it, but the risk is rising and the level of positivity is rising, and therefore so should our plan to respond. And I'm committing to you that we will do that. And we are already planning to have unveiled that for Monday, but given the extension, we'll have that well in place by the 25th to build confidence, to build upon our plan to keep kids safe. And I think in this province, when 8 in 10 schools have no active cases, that demonstrates a strength. It shows you that our staff and our parents and the kids themselves, everyone working together to really reduce risk. And that I think is a good thing.
I'm going to end you on that note. Thank you very much, but I will challenge you again. 8 out of 10 schools with no active cases, that's only symptomatic cases. You don't know that 8 out of 10 have no cases, active cases, because they could be asymptomatic. But on that note, thank you very much, Minister. I appreciate your time, and I'm sure we'll debate this many times more in the future. Thank you.
Okay, thank you.